Hello everyone, I'm Smriti, the wellness coach at Daily Bloom. Okay, let's wait for a few minutes for everyone to join. Am I audible to everyone? Yes, no, any? Okay, thank you, Siriak. Yeah, welcome everyone for this master class. We do this on every Saturday, alternating between nutritionist and wellness coach. So, okay, let's wait for a few more minutes, then we will start. Hello, Dr. Manoj. It's good to see you. Hi, Kaushik. Hello, Neru. Hi, Surya. Thank you for joining. Hello, Priyanka. Hi, Salman Khushi. Welcome, everyone. Just one more minute and we will start. Okay. My topic is about types of IBS and their causes and how they impact our overall health related quality of life. And if you have any questions related to the topic, you can drop them in the chat. Or if you want, you can drop your questions at the end. Okay. Okay. We shall start now. So, good afternoon, everyone. I'm Smriti Dhar, the wellness coach at Daily Bloom IBS. And on each Saturday, we host our master class alternating between nutritionist and wellness coach. So, I hope you're ready for this topic of today. Okay, let's start. Okay. So, what are the subtopics that we will cover today is understanding irritable bowel syndrome, its types and causes, and how it impacts our life, like overall health related quality of life, and what are the challenges an IBS patient face in their life, and the psychological and emotional consequences of living with IBS, and the role of the relaxation techniques in managing those symptoms. Like it becomes important. Most of us, most of the patient follow the diet part of the program, but they are not ready to follow the relaxation techniques, or they think it's not that important. So I've highlighted some clinical evidence supporting the use of relaxation techniques in IBS. So what is irritable bowel syndrome? Okay. So it's a disorder that affects our stomach and intestine, or you can say affects our gastrointestinal tract. And most common symptoms are cramps, abdominal pain, bloating, and diarrhea, constipation, or maybe the combination of both diarrhea and constipation. Okay, and the prevalence of irritable bowel syndrome is about 10 to 15% of the global population. Like 10 to 15% of the people are affected by the IBS, and the most common or the most uh, common age for the onset of IBS is 20 to 30 years. Okay, IBS can start at any age, but it's most commonly begins in late adolescence or in early adulthood. But many people report symptoms beginning before the age of like 50. It's most common, and women's are more affected to it, like 1 to 2 times their affection. The rate of being affected is more than men. Like, now come on to the topic of types of IBS and their causes. So first type is IBS with diarrhea. Okay. So what are the symptoms of IBS-D or IBS with diarrhea? It's predominantly characterized by frequent, loose, or watery stools and urgency. Abdominal pain and bloating are common as well in this IBS with diarrhea or IBS-D. Next is IBS with constipation, or you can say IBS-C, which is characterized by infrequent bowel movements, hard or lumpy stools, and difficulty passing stools. And it may also cause abdominal discomfort and bloating. These two symptoms are common. And third one is IBS with mixed bowel patterns, or you can say IBS-M. It's a combination of both diarrhea and the constipation, and individuals may experience alternating episodes of diarrhea or constipation. The symptoms keeps on changing. And the last one is IBS unclassified, or you can say IBS-U, which uh, whose symptoms do not fit nearly into any of the categories like IBS-C, IBS-D, or IBS-M. This may include a mix of symptoms that are not consistently in any of the categories. Any questions till now, like regarding any questions about types of IBS? If there are any questions, you can drop them in the chat box. Okay, okay, okay. So let's move on to the causes of IBS. First one is gut motility issue. What is gut motility? Like, either the food moves through the digestive tract more quickly than the normal, leading to less time for water absorption from the stool, resulting in the loose or watery stools. Okay, there's one question. Let's wait. Is it common for people above 70 years of age? Yes, it's common, but onset start from the age of 20 to 30 years old. It may be it's possible that it can start, or there are some environmental changes or lifestyle changes um, that the IBS can start at the age of 70. It's possible. Yeah. Okay. Any more questions? Okay. Okay. So let's discuss what are the causes of IBS. Like I was telling, gut motility issue. So either the food moves through the digestive tract more quickly than the normal, leading to less time for water absorption from the stool, resulting in loose or watery stools, or the bowel transit time is slower, which means food remains in the digestive tract for a longer period of time. Okay. And the next one is like gut brain axis dysfunction. So the communication between the gut and our brain may be disrupted in IBS. As most of you would be aware, like there's a communication between our gut and our brain, and leading to that dysfunction can affect our how our gut responds to our brain and leading to the IBS symptoms or triggering of the IBS symptoms. And neurotransmitter imbalance also plays a very important role. Like imbalance disrupt normal gut function and affect the mood, leading to symptoms such as altered bowel habits and the mood changes. Mood changes may be like anger, irritability, or any other kind of mood disruption. Okay. Next is food and diet intolerance. Like certain foods are there that can trigger an individual, resulting in aggravated symptoms of IBS. Like people find that foods high in fat, caffeine, alcohol, or uh, certain carbohydrates like wheat, dairy can trigger IBS symptoms. Next one is stress and psychological factors. Stress can alter the gut motility and increase the gut sensitivity and exacerbate the IBS symptoms. And last one is altered gut microbiome. Like changes in our gut microbiome can affect the gut permeability, inflation, and the production of neurotransmitters, all of which can influence our brain function and contribute to the IBS symptoms. Okay. And there are many more causes like our lifestyle and certain environmental changes, maybe medication. These things can also affect the or cause the IBS symptoms. Now, health related quality of life in IBS patients. Like what are the challenges faced by the IBS patients and what are their impacts? Okay. So first one is impact on the quality of life that an IBS patient face. Okay. So first is physical discomfort, like persistent abdominal pain or the chronic pain, cramping can interfere with our daily activities, reducing the physical functioning and leading to decreased ability to perform the routine tasks. Or like frequent diarrhea, constipation, or alternating symptoms can also lead to the discomfort, fatigue, and physical limitations. In severe cases, it may also affect the overall health due to dehydration or the other some complications. Okay. Next is emotional strain, like how it affects us emotionally and our psychological health. So it often leads to anxiety, depression, chronic stress, and the uncertainty of IBS symptoms. Like the unpredictability of IBS symptoms and their impact on daily life can lead to the significant stress and anxiety. Many individuals with IBS reports like high level of worry about their potential flare-ups and their concern. Like they are worried if they're in a social setting and their symptoms arises there, what will be they doing that time? Or how will they overcome that time? The fear. How will they overcome that fear that okay? So that fear is always there in their mind. And next is social and work disruption. IBS symptoms can lead to embarrassment or anxiety about symptoms in social settings, like I told you earlier. So this can result in avoidance of social activities, reduced social interactions, and isolation. Many patients complain that they don't now often visit their friends, family members, because they fear that their IBS symptoms will arise, and they don't have any clue what will be they doing in that situation. Okay, so it also affects their job performance and attendance at the workplace, like frequent bathroom breaks, absence due to symptoms, and reduced productivity can also impact the career progression and job satisfaction. And the need to plan around symptoms and potential flare-ups can limit participation in everyday activities, travel, and recreational pursuits. And it also affects our financial condition or financial situations, like the medical consultation with healthcare providers, diagnostic tests, and medication contribute to a direct medical cost. Like some people are not able to afford that. Okay. So these are the challenges that are faced or that impacts the health related quality of life of an IBS patient. So there are some challenges they face, like impacts and the challenges that are faced by the uh, IBS patients, like variability of symptoms. So unpredictable nature of IBS makes daily management difficult, but through Daily Bloom app, you can keep the track of your symptoms. There's a thought tracker on the app in which you can track your thought process or your stress level. So diagnosis and treatment. Lack of definitive test and trial and error approach to treatment can delay effective management. So, and this also Daily Bloom app helps you, or the Daily Bloom program helps you. It provides you a thyroid blood test. So it's it's so free of cost, or certain discounts are there. So you can take that. Dietary management, like strict dietary restrictions can be hard to maintain and impact social eating and lifestyle. So Daily Bloom program helps you to eat what you favor, like what is your favorite food, and they make our nutritionists customize your diet according to that and help you to maintain your diet properly, as there is a log option, like meal logging option on the app. You can anytime log on the food that you have taken, and if there is any flare up, you can report it on the app anytime, and you can provide the cause, that why is cause what causes it, like is was it that food triggered you, or it was like any health issue, work issue, or any issues that triggered it. Okay, and next is psychological impact. Chronic stress and mental health issues may complicate symptom management and overall well-being. And for that, you have us as wellness coach, uh, who schedule call weekly to provide you the to help you with your overall mental health or well-being. You can discuss any problem that you're facing in your life, or at your workplace, at your school, or wherever, at your relationship, anything. And access to care, that is limited availability of comprehensive multidisciplinary care can hinder effective management. But fret not, Daily Bloom program is there, and it provides all-in-one option. Like, you just have to enroll to the program, and you will have all the support from app, from the program, from the nutritionist, from the wellness coach. Everyone will help you or try to support you to make your IBS manageable. Okay. Okay, there's one question, but I think I will reply at the end. Is that okay? So, moving on to how you can improve your health related quality of life through relaxation techniques. Like, you can improve it through dietary management, properly following all the diet, and maintaining physical activity in your life. But I am here focusing on more on the relaxation technique, because some patients are there, like what will happen if you're practicing relaxation techniques, like nothing changes if you're following the relaxation techniques. So we need to improvise the importance of the relaxation techniques. Okay, like why is it helpful and how does it can affect? Okay, so first one is it helps in stress reduction, like impact on the symptoms. Stress is known to exacerbate symptoms as uh, it increases the cortisol level in our body, which is a kind of stress hormone. Okay, so relaxation techniques help to reduce stress, which can elevate the symptoms such as abdominal pain and bloating. Uh, whenever we are in stress, we face fight or flight response. So our breathing becomes rapid and shallow. So deep breathing or any relaxation techniques helps you to reverses that and sends message to the brain that to begin calmness in your body, and practice will make your body respond more effectively to relaxation or relaxation techniques or deep breathing in the future. Like if you're practicing one day and not practicing any other day, one day is enough for you. So it not happens like that. You have to consistently practice that to get a better result. Okay, it reduces your stress and it improves your gut brain communication, like techniques like deep breathing, progressive muscle relaxation. It helps to improve the gut brain communication or the gut brain axis, which is an essential part of the uh, IBS symptoms management. Okay, so it calms your nervous system, like progressive muscle relaxation. It calms your nervous system and help you to come back from the fight or flight situation. And it also improves your gut motility and reduce the visceral hypersensitivity, which are the more common issues in IBS. And next is it improves your overall well-being, like regular practice of it can reduce any kind of stress or anxiety that you're facing, which are more frequently associated with IBS, and it leads to the better management of IBS symptoms, and it helps you to cope up in a positive way. Like most of the people cope up, and the easiest ways to cope up is in a negative way, but those relaxation techniques helps you to cope up in a positive way through uh, by enhancing your resilience or uh, controlling your flare ups. And in a social setting, when you're there, like you can practice cue controlled relaxation, which will help you in managing your symptoms in a social setting or any place that you feel like you're having any kind of symptoms, and you can practice those, or even deep breathing can help you in that. Okay, and last one is like improve sleep. It helps you to get proper sleep without any disturbance, like calming your mind and body, making it easier to fall asleep. So sleep becomes an essential or crucial for IBS patient, because if sleep is not complete, we will get angry or irritated. So it also causes stress. We will feel tired or lethargic, or we will not feel fresh. Okay, so it's important to improve your sleep quality, and it also lowers the stress level. As we all know, when we are in the REM sleep, we dream, we often make our the decision making capability increases or develops in REM sleep only. So it's important to have a proper sleep. So these are the clinical evidences that supports the use of the relaxation techniques in IBS. Like uh, it's an Indian study. I'm not presenting any kind of foreign study that happened in US, UK, any other place, but these are all the Indian studies only. Like the first study is progressive muscle relaxation for IBS, a study of efficacy and perception. It was done by Chawla, Singh, and Kapoor, and it was also published in Journal of Gastrointestinal and Liver Disease, and it's a recent study that it was published in 2023. So the summary, the study explored the effects of progressive muscle relaxation on IBS symptoms, and its finding indicated the improvement in the symptom severity of the IBS patient including reduced in abdominal pain and bloating, and progressive muscle helped in effective was found effective in managing the IBS symptoms and improving the patient satisfaction. And the next study is sorry, uh, done by Verma, Agrawal, and Sani. So it's a systematic review of relaxation techniques for IBS, and it's also an Indian study, and it's a very recent study, like it's published in 2024. So the systematic review analyze the effectiveness of various relaxation techniques, including yoga, mindfulness, and progressive muscle relaxation in managing the IBS symptoms. It summarized the findings from the Indian studies and global research. Like it was a summation of some studies that happened in overall from in a global population and all over the world. So it's the summation of that studies. And it was found that relaxation techniques supported by evidence from Indian and global studies are effective in management of IBS symptoms and improve quality of life. Okay, so this was the masterclass, or this was the webinar about how relaxation techniques are important and how we can improve the health related quality of life in IBS patients from following certain diet and certain relaxation techniques. And now if you have any questions, you can comment it in the chat box. Okay, so there's one question. Okay, so Mr. Salman Khurshid, I want to ask, like, were you following 100% of the diet and doing all the physical activity like yoga, relaxation techniques? Any other question you guys have? Yeah, yes. Okay. And Mr. Salman, were you also cheating on the meal? Like, any cheat day were you following? Thank you, Dr. Manoj. Mm, okay. Acid tablets. One thing is there that like I'm the wellness coach, I'm not the doctor, so it's better to ask about IBC tablets from a professional, like from a doctor or from your not general physician, but whatever doctor you are seeing, you can ask from him. As I'm only a wellness coach, or you can say psychologist, so that's why. Okay. So you were following everything which is possible. Okay. Thanks, EDI. Okay. Any more questions do you have? So the pointers from this masterclass was like how relaxation techniques are important and how we can improve our health related quality of life, and what are the causes and how we can prevent or take better care of ourselves to prevent those symptoms from arising, and what are the things. Okay, normal how long this will remain. Okay, so there's one question. So it's manageable, not curable. I think I answer your questions, Mr. Nehru. Okay, so yeah, okay, thank you. If that's all, I think then we should end our session. So thank you everyone for joining the webinar. I hope you get some knowledge about the IBS through the webinar held today. Okay. Okay, well, sure, share you. Yes, Dr. Mal, share you. Yeah. So thank you everyone. Have a good day.